is Dr. Amandeep. I'm a consultant neurologist at Sohana Hospital, Mohali. So today's topic of the meeting is on epilepsy. Is What is epilepsy? How we recognize the features, how we can manage it, and what are the various issues related to the patients who are suffering from this disease. The psychological issues, the organic conditions what they are facing, some mental stress, and what is dilemma regarding the treatment of the epilepsy, and some other issues which are related to their life quality, their education, and their uh, life job, their earning. So the number of issues are related to these patients. So what is epilepsy? As we know, it's a disease in which the patient is having recurrent seizures of unprovoked cause. So whenever a patient who is having two or more episodes without any provoked cause or any correctable cause, we call label this patient as epilepsy. So the causes of commonly precipitated seizures are like dyslipidemia, low sodium, low RBS, hypoglycemia, CNS infections, trauma, any stroke, infarcts, emboli, any bleed, which can precipitate the seizure. When we have these obvious causes of seizures, then we call it as symptomatic seizures. Otherwise, when there are unprovoked seizures, so two or more, as I've said, if the patient is having, or there is any syndromic cause of seizure in a child, then we label this case as epilepsy. So, how do we proceed with this case? The history is at most important. So we identify and diagnose this epilepsy only by the basis of history. So history is very important. So whenever this patient is having seizure, the eyewitnesses, his friends, relatives are told that they should be very vigilant in observing this patient. So how to recognize this epilepsy? So we have to ask what were the pre-symptoms before this episode, what the patient was seeing or facing when while he was saying any abnormal smell, taste, any abnormal visual uh, things he was able to see, bright lights, hallucinations, any formed objects, any auditory sounds he was hearing before this episode. Then once the episode starts, the family members have to see should look for what is the features or what are the semiology, whether the patient is having neck turning, which side the neck is getting turned, so how the eyes were, what was the posture of the limbs, was there unilateral or at the onset there was both the limbs were simultaneously involved, was there loss of awareness or not, or the patient remained conscious throughout the event. So these are the points which should be very closely watched upon. Was there any tongue bite, was there any incontinence, was there? So these are the various points how we can recognize the seizure, and we can classify whether this was a focal seizure, partial seizure, or it was a generalized onset seizure, or sometimes there are myoclonic type of seizures in which there will be only the jerky movements will be there, and especially in the young females, adolescent females, we have to ask for this history. Then family history is also again very important. So if you find any case of epilepsy patient, you can guide this patient to get a treatment, proper treatment from the physician or the neurophysician. So, what are the steps or first aid whenever a patient gets a seizure episode in front of you? So, you may be traveling or standing somewhere where a patient just suddenly falls or start having this symptoms which I've just described. So, how to manage a patient who is having a seizure in front of you? So, this patient is to be managed by you only when you are there. So, it's not nothing to panic. Just make the patient lie down in a safe place. He should be away from any sharp object, any nearby hot object. He should be in a safe place. Just side turn the patient. Now, as the patient is having during the seizure, a lot of secretions are getting pulled up in his oral cavity. He may get aspiration and may have difficulty in breathing. So just turn up the patient to the one side and keep it on the lateral side. Just clean his all the secretions from his mouth with a clean cloth. Don't try to open up his clenched teeth with a sharp object, iron object, or a spoon, which commonly people start doing it. Don't make it कि उसको smell सूंघा दे. Don't do it any socks or smell. This will not abort his seizure. Just give a turn to the patient. Wait for his seizures to settle down. The patient, usually the one who is wearing a tie or a tight cuff, should be loosened up so that he can breathe easily. And once the seizure is over, the movements will get settled down in half 1 minute. After that, make the patient arousable, and he will be getting your commands. And within few minutes, he will be conscious. By the time, keep the patient in well safe place. Once he gets up, regains consciousness, then only patient should be moved to a hospital. So after the seizure episode is over, the patient will regain the consciousness. We should move him to the nearby hospital or the healthcare. If a patient is a pregnant woman, or the person is a cardiac patient, or it is a the patient has recurrent seizures within a couple of minutes, and in between the seizures the patient does not regain his consciousness, then it is becomes an emergency to immediately shift the patient to a nearby hospital. Otherwise, you can manage the case then and there only, and after settling the patient, then only shift the patient. And these are the 2 3 emergencies. If the patient is having recurrent seizures without regaining consciousness, or she is a pregnant woman, or it's a cardiac patient, then you have to rush. Immediately, you have to take the patient to the hospital, and you have to manage there and then only. So there's a dilemma about the this disease, as well as about the treatment which we give for this epilepsy. So these patients very frequently feel that the medicine once started is lifelong. The medicine will become part of their life. They cannot control their disease without this drug. Then this drug become dependent. So this is a very big misbelief. So the this is a very important message to the viewers, that this disease can be very well managed and controlled with anti-epileptic drugs. So 70% of the seizures, epilepsy patients, we can control the seizures with single drug only. Only in 20% of the patients we have to give one or two anti-epileptic, couple of anti-epileptic drugs to control the drugs. So once the seizures are well controlled, they can very well lead their normal life like other people, can perform continue with their educational activities, their classes, studies, and job as well. And only in 7 to 8% patients we have refractory cases in which we have to advise surgery or give more than 2 anti-epileptic drugs and other therapies for refractory seizures. We have to recommend the ketogenic diet in those patients, and strict precautions are to be followed. Then, regarding the treatment, the patients should be well aware that this is the only treatment that they should follow. Otherwise, there's a lot of social taboos and misbeliefs. They start going to quacks and babas and putting up all sort of threats that this will control their disease. If we talk about the mental status of these epilepsy patients, already they are suffering a lot of mental trauma from their family because of their disease, ongoing treatment, from their relatives, and the background, social background they are hailing from. Especially in the rural background, this is a very big. It is considered as a very big dreadful disease. Ki this will spread, or it will pass on to the other family members or the children, which is totally wrong. And these patients, along with their relatives, are to be counseled and made aware about the this disease, that it is not at all communicable. The risk factors remain genetic, and sometimes the fetal malformations and hypoxic injuries which occur during the pregnancy, or any abnormality in the brain formation of the morphologies. So these patients are facing these societal issues. These patients are facing, they are lacking in their studies, they lack confidence, they always have uh, they are always most of the time performing poorly during their in their academics. So this epilepsy with the repeated seizures, and along with that the ongoing anti-epileptic drugs, they definitely affect their cognition, their intellectual part, their decision making, their attention. their skills like calculation, problem solving, they all become slow and are not at par to the children which they are studying with. So these patients very frequently, because of this, sometimes get depressive thoughts, develop low mood, and most of the older anti-epileptics were also having the issues of excess weight gain, and which made to look them like obese, causing their affecting their facial features. So these all issues club and affect their mental status, and very commonly these patients may go into the depressive illness, and they develop along with this epilepsy the depressive symptoms also. So cognitive issues, behavior issues, these psychiatric manifestations are very commonly seen, and very young females along with the seizures, because of the psychiatric manifestations, start having the pseudos, what we call as a pseudo seizures, the unexplained episodes of loss of consciousness, so which are to be taken care of. So doctor has to very frequently during their follow-ups ask about their mental status, their mood stability, any issues, family issues regarding their studies, their job, their earning, their family pressure is there on these adult males and the females which are epilepsy patients, regarding the taking care of the family. So these all parameters are to be taken care of while giving treatment of epilepsy in these patients, so that the quality of life is good, because they are somewhere lagging in their educational qualification, they are lagging in their confidence level, then they are lagging. Because of this, they will get some difficulty they will be facing in getting good jobs. So obviously all this lead to financial issues, puts pressure on them. So these all issues are to be handled along with giving the anti-epileptic drugs, and simultaneously the drugs are also causing this cognitive impairment. So I think these all issues should be taken care of 360 degrees, so that the patient is getting controlled with his seizures also, and also simultaneously he is able to lead to a very normal life, and can have a good quality of life with controlled seizures, and having his basic education and basic work, so that he can manage his finances also. This is all what is required in a patient of epilepsy. Thank you.